Gift of the Givers Foundation has completed a R5 million upgrade at an Eastern Cape hospital, Nkqubela TB Hospital in Mdantsane, that's East London, underwent, I should say, the infrastructure upgrade, including the refurbishment of wards that will accommodate 96 additional beds. The hospital is one of several in the province that are receiving infrastructure upgrades through the Gift of the Givers. Let's speak to the organization's founder now, Dr. Imtiaz Suleiman, joining us from KZN tonight. Doctor, always great to speak to you. Why has it fallen on your lap to do this work, the refurbishing of this hospital?
Hi, Nkqubela. You know, whilst we were busy during the COVID since March 2020, we've been meeting CEOs. We've visited 210 hospitals nationwide. And our focus over a period of time grew in the Eastern Cape for various reasons: the hunger, the water difficulties, and the hospital itself. And Eastern Cape has many hospitals that are very rural. Not that the hospital that we upgraded is rural, but when speaking to the CEOs and building a relationship with them, when we brought in PPEs, oxygen machines, high flow nasal oxygen machines, the CPAPs, the scrubs, and they would take us to the hospital. They said if only there was some money, we could make this hospital more efficient. We could do more here. We could put more patients in here. COVID has increased the demands on our infrastructure, but there's a budget deficit, in the health department nationwide. And at the end of the day, you see, who benefits is the patient. And if you upgrade something, you bring hope to the healthcare workers, the medical managers, the nursing managers, the CEOs, and above all, you bring hope to the patients when they come into a facility. They see it's beautifully done, like a private hospital, and it just gives them so much encouragement to be in that hospital. So based on that philosophy, we started going to various hospitals and started upgrading them. In fact, we finished another one yesterday, and there's 2 more starting in the new year, and there's more to come.
But Doctor, admirable as the work that you're doing is, and it will likely continue for a long time to come, a lot of people would ask, why is it that the situation has been allowed to deteriorate to a point where the health department in the Eastern Cape is facing such dire budget shortages, deficits, that a charity organization has to come in and do it, even after, as you said, in the last year, you've spoken so much about the crisis of healthcare in the province?
Nkqubela, I think the problem is how the money is allocated. First of all, let's make a statement, a fair statement. The taxes of 8 to 9 million people can't pay for 60 million people's necessities. There's just not enough money in the government budget to take care of all the issues in the country, be it health, water, infrastructure. It's not possible for 9 million people's taxes to pay for all that. The second problem is that with COVID itself coming, it put a huge strain on a lot of resources, and a lot of resources had to be diverted towards COVID itself. Thirdly, and that one is the government's fault, where there's corruption, where there's overpricing, where people pay and there's mismanagement, and there's no proper utilization of money. That the government must take squarely the blame for that. But the other 2 categories, I can't blame them. It could happen to any government anywhere in the world. Eastern Cape itself, the new MEC is coming. I can't hold her, and nor the new HOD responsible for what's going on. She walked into a landmine, into a minefield. She came into an area when there was a deficit of 4.4 billion rand for medical education. So I met her in April, just as she came into office, and she was very open and said, look, we've got a budget problem. There's not enough money, and any partnership would help because we have this issue. So she's walked into an area that's already messed up. So I don't know who takes the blame. The people before her, or what happened before that, we don't know. I certainly can't blame the new MEC and the HOD currently. But that's not going to help. We need to do something to solve the problem. And right now, the finance minister, Godangwana, has collected 150 billion rand, which was not expected. And my priority would be to advise the finance minister, let's put that money in the hospitals. Not only in the Eastern Cape. Charlotte Macquarie is waiting there and not done. 6 months have gone. And, it's a huge loss to the city, the whole country, and even to the continent. They need to fix that hospital up. And there's so many hospitals in South Africa that need support. And then, of course, you've got no money to pay for junior interns and interns to go into hospital. Well, the healthcare workers are overburdened, they're exhausted, and now many of them are positive for the current wave, so they have to be isolated. What happens to patient care when so many healthcare workers are knocked out of the system. We really need to spend the money in health in this country.
Are you also, doctor, then, I know you had, at the beginning of the COVID-19 pandemic, got some volunteer doctors to set up facilities to treat COVID-19 patients. Are you finding that you're also having to roll up your sleeves and attend to people medically?
No, not in this wave. This wave is completely different. When the waves come, I know it's a disaster because the amount of calls and emails and WhatsApp messages we get. In this wave, from the 24th of November, when the Omicron strain was first identified, it was identified on that date, but it should have been there for days before that. So there's probably other patients who had the condition already, the new strain. And from then till now, I haven't received a single call from a CEO, hospital manager, medical staff, my gift of the givers teams of hospitals, the public, the people who give out oxygen concentrators. Nobody, not a single call to say we got a crisis. We need oxygen. We need machines. Not a single call. In the first, second, and third waves, the calls came in the thousands. We were flooded, and our teams were running everywhere. This time, we are very relaxed, because it seems to be very much milder, and there's no oxygen demands. And a lot of those people who are found positive haven't gone in for COVID treatment. They went in for something else, and COVID was found incidentally in those people.
What you are dealing with at the moment in the Eastern Cape is also a shortage of food for people who are in hospital for various reasons. How many people are you finding that you have to cater for? And in terms of resources, do you still have enough to see them through the long term?
Yeah, the food is not a new thing. The first calls came in September of this year, when we got a call and a hospital, and it wasn't a WhatsApp message, it was CEO that was crying and said, look, I don't know what to do. My patients are very hungry. We just don't have the food. We don't have the budget. And there's a problem, somewhere along the system. Can you help? So we asked, is it only you? So the CEO said, I'm not going to say he or she was not sure. So we've got a chat with the CEOs, and we put a message on the chat and said, has anybody got a similar problem? Within seconds, 34 hospitals responded. And then we made an arrangement from our warehouse at that time in Kraftinet. We informed the Premier, we informed the MEC of Health, and they both said, we appreciate the assistance because of the budget problems, and the MEC herself will come there and be part of the process. And she came. She came to Kraftinet, and she acknowledged and she thanked, us supporting them and supporting the patients and the CEOs. And the CEOs themselves drove huge distances to come themselves to collect the food. Mm-hmm. And then last week, we got the calls again. We thought they would be okay till, for a period of time. And last week, the calls came again. Again, the one CEO started and the second one started. They said, there's a dire shortage, there's a crisis, the cupboards are empty. Can we respond? So we said, is it okay like this Friday, yesterday? And they said, yes. So we set up a new warehouse, which is going to become our permanent warehouse in East London. And within a short space of time, again, 42 hospitals responded. But on Thursday, 3 hospitals said they can't wait anymore. They can't wait till Friday. Mm-hmm. They need the food like yesterday. So 3 of them came the day before to collect the food. So we have surplus stock. We always on standby. We always stock our warehouses up. So if they need to carry on for the next month or two, we will be there to support them. And, until they sort the problem out. And again, I say it goes back to the National Finance Minister. They have to look at the health budget in all the provinces. Those that got the problems, provide the food, provide the infrastructure, but more than anything, provide medical personnel. Without medical personnel, the hospitals are going to collapse.
And what about donations, Dr. Suleiman, before we let you go? Are you still getting enough?
Fortunately, the word I've been using recently is active citizenry. Mm-hmm. And a special congratulations to the corporates. They've come to the party not to sign a register, not to get a B certificate or not to get a tax certificate. They've come in with genuine interest to help the people in the country. The support is coming. But the needs are huge. Today we funded 18 cataract operations in East River. That's in the Western Cape. We've got demands from other hospitals that need to be upgraded. We're putting 6 bores right now in different hospitals in the Eastern Cape. There's a water shortage. We've authorized the funding of 1,500 backlog surgeries in Groote Schuur Hospital, starting early next year. We are partnering other private hospitals to get them to take patients from the public hospital and funding that. It doesn't matter how much money you give us. We always want to buy it and spend it on something. And we want to put in a lot of money in Charlotte Makeke Hospital. We want to raise this issue with government. It's a mess. It's a total disaster. It makes no sense why they're dragging their feet on this hospital. It has to be sorted out. And if the private sector wants to come in, we need to take over the hospital ourselves and sort it out if the government can't do it.
Dr. Imtiaz Suleiman, good to speak to you. Enjoy the rest of your evening, sir. And thank you for the work you do.